Cushing's. So with the paraneoplastic syndrome, your own hormones can betray you. You have a small cell lung cancer that produces ACTH and it floods the body with cortisol. And this is Cushingoid symptoms like weakness, bruising, high glucose. And so if you're given a high dose dexamethasone, then pituitary tumors usually will back down. But ectopic tumors, they don't care. They're rogue. They don't respond to feedback. So the ACTH and the cortisol will stay elevated. And so in this question, we have a 58-year-old man with a 50-year PAC history with new onset muscle weakness and facial fullness. He has elevated cortisol and ACTH levels that are not suppressed by low dexamethasone. You can try to suppress it, not going to happen. And also there's a hilar mass. Okay, this is a neoplastic syndrome. So we're thinking ectopic ACTH excretion. High-dose dexamethasone does not suppress it, so small cell lung cancer is going to be the cause. Elevated ACTH is going to persist. There's no feedback inhibition. That's what's happening. It keeps pumping out the ACTH, and so the cortisol is going to remain elevated. All right, that's the way to think about this. That's just one of the examples you could see. You might see like ACTH decrease and decrease. That would be like a high-dose dexamethasone does not suppress the ectopic ACTH cases. That's like Cushing syndrome, for instance. These can be pretty complicated unless you just draw it out. The etiologies are like pituitary adenoma is what you're thinking of, and maybe ectopic ACT secretion, and an adrenal adenoma or a carcinoma when you're looking at a Cushingoid patient. So if it's ectopic ACTH, then after you give them high-dose dexamethasone, it's still going to be increased ACTH and cortisol. It just doesn't carry no feedback inhibition, right? And if you do a high-dose dexamethasone suppression test and it decreases the cortisol, like it works, then it's a pituitary adenoma because that will back off. That'll be like, hey guys, it's fine. We don't need it anymore. And so you'll have at low cortisol. In that case, when you do the high-dose dexamethasone suppression test, that's a pituitary adenoma. Will respond. You'll have lower cortisol after you do that. And the adrenal adenoma carcinoma, your cortisol will remain elevated and you'll have lower ACTH and increased cortisol. Okay, so that's the basic spiel there. The reason why is because adrenals, you don't need the ACTH because you're just primarily secreting that cortisol. Okay, well, that's it for now. We'll see you in the next vid.